Welcome to the program. This is Health and Lifestyle. Our socials at Mariambo, at KBC Channel 1 on X and KBC Channel 1 TV on Facebook. Pediatric medical emergencies involve serious health issues or injuries in children that require immediate medical attention. In today's program, we focus on these emergencies that can range from illnesses to accidents such as falls or head trauma. Coming up in today's program, 41 out of every 1,000 live-born children lose their lives to pediatric medical emergencies.
The ginger, the hot water is just there in the house. So it's easier for you to use and able to cool down that fever.
And in our Word on the Street segment, Kenyans share their home remedies for managing fever. All that coming up in the program, but let's begin here, where having a severely ill or injured child is every parent's worst nightmare. If your child were to experience such an emergency, would you know the best course of action for seeking treatment? Pediatric medical emergencies, which involve serious injuries or illnesses that threaten a child's health, affect children from birth all the way to 18 years. In Kenya, pediatric medical emergencies result in 41 deaths per 1,000 live births among children under 5. That is according to the 2022 Kenya Demographic and Health Survey. Many of these emergencies stem from preventable causes such as diarrhea, pneumonia, respiratory issues like asthma attacks, and allergic reactions to foods, medication, or environmental factors. Other emergencies include traumatic injuries like head trauma and fractures, dehydration, and heat-related illnesses. While a fever on its own is not typically considered an emergency in children, a high fever, especially in young infants, about 37 degrees, can be concerning. It may require immediate medical attention, particularly if it's accompanied by symptoms like difficulty in breathing, lethargy, or signs of dehydration. Before we speak with a pediatric emergency doctor, we asked around, how do you typically handle fevers at home?
I'm a mother of 3 kids, 3 boys. The last born is 6 years, first born 12. So when they have fever, first of all, I run for counter medicines from the chemist. If they don't work, I prefer ginger, garlic, and honey. I boil and I give them the mixture. And sometimes it works. If it doesn't work, the cough persists, I seek medical assistance from a professional doctor.
Most of the time when my kids have fever, what I always do, I took some warm cloth. I try to squeeze it kama ni kwa koo hivi. Kama mtoto unasikia ni kama vile ana cough, akona kitu kama ni baridi na akona coughing. Huwa naona ina improve breathing yake. Juu wakati mwingi akiwa na hiyo coughing, kuna hiyo unamuona tu, ukimtazama unaona ana breathe heavily, so waga ina cool. And then wakati naona maybe mtoto haja improve, waga nachukua hatua ya kumpeleka kwa daktari.
To confirm to you first, I'm a father of 4 kids, 2 daughters, 2 gentlemen. The oldest one is 15 years. Yes, so I still take care of them. When they have fever, we use ginger, we use lemons, which are antibiotic. And in my study, I found them that they are really true antibiotics under what we call pharmacognosy. Yes. The reason I use them is that you see a child can fall high of the fever, even in the middle of the night. And where we stay at times to reach the hospital facilities far, transport is a challenge. But the ginger, the hot water, is just there in the house. So it's easier for you to use and able to cool down that fever. You're able to manage, and at the end of it, the kid becomes okay. And at times it's very fast helping.
Well, so there you have it. Some people use ginger water, others use a wet cloth. I don't know what you use. You can actually let us know on our social media handles at Mariambo, at KBC Channel 1 on X, and also on our Facebook page, KBC Channel 1 TV. And on that note, we take a break, but we'll be back with much more. And we are back. Thank you for staying with us. Children have distinct physiological and anatomical differences from adults, which require tailored care and attention during emergency medical treatment. A pediatric emergency medicine doctor plays a critical role due to their specialized training in quickly assessing and managing children with acute illnesses or injuries. Dr. Lorraine Okech is a pediatric emergency medicine doctor, and she starts by discussing the risks associated with high fever in children. Let's take a listen. So thank you so much, Dr. Lorraine, for giving us time to talk to you. But let's start by you introducing yourself and telling us, what does a pediatric emergency doctor do?
These are doctors who you've done your undergraduate in medicine and then you've gone in to do a master's in pediatrics. So you're called a pediatrician. And from there now you can specialize into other subspecialties in pediatrics. Now for me, yes, I've done my undergraduate and then I went on to do a postgraduate diploma in pediatric emergency medicine. So where a doctor like me is situated is in the pediatric emergency room.
Just like you've already put it, like a pediatric emergency doctor deals with emergencies in children. Definitely the emergencies that an adult will present with at the ER and what a child will present with is totally different. I mean, a child will put a coin, in their mouth. As an adult, that's not what I would do. And so that means you need to have that background to understand how to handle a child when such things happen. But what are some of the most common, emergencies that, children, present with at the emergency?
Swallowing a coin. These children, they will put in anything into their mouth, especially the young ones, below 5. You really won't have the older ones putting in things that they shouldn't. So a child whose airway and food pipe, what we call the esophagus, is small, So you swallow a coin, say, these days we don't have so many coins, but the biggest coin we have, 20 shilling, 20 shilling coin, and it goes in and gets stuck. So the child starts choking. So let's just say generally choking. Other things are, say, dehydration. A child has been having diarrhea and vomiting. You've taken it very, very quietly, and you've said, wacha tumpatie maji, let's give this child water and it'll be fine. 2-3 days, you've kept this child in the home, they're having diarrhea, vomiting every day, every day. In a child, this is very critical because if you leave it, we all lose water, even adults, when you have diarrhea and vomiting. But for a child, because of their surface area to body ratio, it is, the more water you lose, the easier you get into what we call shock. So you get dehydrated. If it continues, you get into shock. You bring your child in. So dehydration is actually divided into different categories. There's some dehydration where you've just lost a little bit of water. There are things we look out for. There's severe dehydration, and then there's shock. So severe and shock is actually really bad. We have to intervene very fast because a child can go very fast into shock. And this shock, if not taken care of, this child can actually succumb to this illness. So that's another thing. Other things are pneumonias, having a child who's coughing, fevers, and then they come in, at the point where now respiration their breathing is compromised, so we have to intervene. Asthmatic attacks, these are very, very common in our setup. Poisoning as well, as much as they've ingested things and they're choking, there are things that children may find a pesticide somewhere in their house, you've not kept it well and they drink it, and you find a child who's unresponsive and you rush them into the hospital. So there's a wide range of things that, we see in the emergency setup.
Mm-hmm. So talk to us about fevers, like you've already mentioned. It's one of the, can I say, emergencies that parents will present their children with in hospital. There is this tendency to give medication immediately. A child, you feel like a child is hot, or the child comes and tells you, Mommy, I'm feeling a little bit hot, and all that. But maybe you could just take us through fever. Is it definitely not say a bad thing or a good thing, but is fever an indicator of an underlying problem?
A fever is a good sign. It is telling you that there's something going on in the body. So this is the body's response to something foreign, something foreign going on in the body. So say infection, that is the most common cause of a fever. So a child has an infection, the body will respond, fevers, temperatures rise, and then you need to intervene as you need to intervene. If you've been advised by your doctor that if you see a fever of this degree, then you give paracetamol. So what would happen is a child has a fever, There are degrees that we look at. You touch, you see the child is hot, or the child tells you, Mom, I'm feeling hot. You take a temperature, always have a thermometer in the house. You take the temperature, it's 37.3 and going up. So in the past, we've had 37.2 as being the cutoff, but recently now we are seeing even 37.1 and 0.0 is considered a low-grade fever. So when we get there and we see that it's now rising, then you have to be on alert. So what we advise is you first undress this child. Don't go, we avoid medication as much as possible. If you don't need it, don't give it. So undress the child, keep monitoring. If it keeps going, give your paracetamol, of course, at the right dose. Then now, if it keeps rising despite giving the paracetamol in the correct dose and at the correct time, you definitely have to come in so that we see what the problem is. Now, a fever becomes an emergency when it is rising despite the medication given. Say you've already even gone to the hospital, had an infection, was given antibiotics, but this fever continues on for 2 to 3 days, it's not relenting. Or when it's really high, because when it's really high, especially in the under 5s, there is a risk of getting a seizure. So what we call febrile convulsions. This is, the brain has a thermostat. So when the temperature goes above the set temperature of the brain, then the electrical activity is messed with, and then that is what results in a seizure. So in those instances is where, okay, this is an emergency. Let me rush this child to the hospital. Fever is going up, it's not going down. The child is, or even may get a seizure in the house, then you have to rush that child immediately to the hospital.
Okay. Yeah. So I think I'm not alone. Many parents do this. When the fever is high, what you do is take a towel, put in cold water, and can I say, dampen the baby a little bit. Is that the way to do it? Should we use cold water? And also there's this thing where we overdress children. It's hot, but the child is swaddled in, all manner of clothes, the layers, and plus baby shawl and everything else. Maybe you could talk to us whether that's the right thing to do, or how should we go about it?
This is a human being. The heat you're feeling is the heat they're feeling. So remove those layers. Of course, you want to protect them from wind and any harsh conditions, but heat, especially when it's hot, don't overdo it. Immediately you notice that this child the temperature is rising by touch, take your thermometer. Always have a thermometer. If you have a child, have a thermometer. Take your thermometer and check. If at that point it's 37.6, 5, 6, 7, give the paracetamol. Of course, the first thing, like I said, the first thing you will do is undress, because many times you'll find that child has layers. So undress, take out the layers. If they can actually remain even just with the underwear, they're in the house, let them remain like that, because no one else is seeing them. There's no embarrassment to that. Let them remain. You can do what we call tepid sponging. Take warm water, a towel, and then just sponge the child. You can even put the child in a warm shower just to help that reduce that temperature. But at that point, if it's still rising, 37.5, 6, 7, 8, going into 38, you have to give medication, because if you just wait, then you have that risk of other things happening, especially in the under 5s, getting a febrile seizure. So yes, you would give. So always, I tell parents, especially of the young children, have your thermometer, have paracetamol, so that, before you even bring this child in, because you might say, let me wait and then I'll go to the hospital. On the way, you get a seizure. So take care of it. Make sure it's at the right dose. That is very, very important for children. We get many children coming into the emergency room. Parent is like, but I've given paracetamol over the last 2 days. This is not relenting. When you look at the child's weight and you look at the dose that they're getting the medication for, you notice, oh, wow, this is underdose. So it definitely will not take care of the fever as it should.
Yeah. Another thing that happens, when children are young, they can put anything in their mouths, in their noses. But let's talk about choking. I once had a scare, by the way, with one of my firstborn, or can I say, put a coin in their mouth. How should a parent handle choking?
So as much as possible, stay calm, because being frantic, it's easier said than done that we need to stay calm. But as much as you can, you need to stay calm and not be frantic, so that you can be rational in how you think. So if you're trained in first aid, or you know what to do, with choking, there are maneuvers that you can do. If it's a small child, you'd have to place them on your lap, and there's a maneuver that you would do to just help bring out whatever the child is choking with. Or if it's an older child, you can put them in front of you. There are maneuvers. As you grow older, you just do it like an adult. You do the thrust at the abdomen. Then after that, if you're not able to, if it doesn't come out, rush the child to the hospital. It still is prudent to take the child once it comes out, just for a checkup to see if there's anything that may have happened in terms of injury as it comes out, because it depends on what the child has swallowed.
So let's go to coughs. Very common in children when they're young, during the cold season, coughs and flus. In most cases, we self-medicate. But how should a parent handle coughs and flus?
So coughs can signify very many things. The most common thing, the flu. If you get the flu, you may have a runny nose, sneezing, and coughing. Other things, maybe an infection in the lower tract. A flu is in the upper tract of the respiratory system, so the lower tract may signify pneumonia, which comes in with breathing difficulties. You may have fevers as well. Even with the flu, you may have fevers. So when a child begins to cough, most times we do not rush our children to the hospital when they begin to cough. You can do your home remedies, just eat lots of fruits, take lots of, fluids, just the way you would remedy a flu, even as an adult. If it's not getting better, you've given dawa for fever, you've done your home remedies, the cough is getting worse, please go to the hospital. Avoid going to pharmacies, go to the hospital, be checked. Then now we can ascertain as to what it is exactly. We get a lot of, same thing, we get a lot of children coming in having been given cough syrups. So yes, now the cutoff depends on the doctor. The reason why we do not advocate for cough syrups, like you will come in and tell me, but I gave a cough syrup and the child got better. Yes, because they have ingredients that will take care of that cough suppressants. But some of these things that are in the cough syrups may cause some side effects that may be detrimental to the child. Case in point is respiratory depression, meaning the breathing of the child may become be a problem. So the child may start breathing slower, but this child won't tell you. Depression means the breathing has been suppressed. The breathing center in the brain has been suppressed. So this child will not tell you. The breathing is just, then you end up with a child who just had a flu and a cough. You've given a cough syrup and you're in the emergency room now because you've now noticed that the breathing is really slow. This child is having difficulty in breathing. So because this child cannot tell you, we avoid it altogether. So some people will say 8 and above you can give. Some will say 10 and above you can give. It depends on the doctor that you will see. But I would cut it off at, now from 8 onwards, because at 7, from birth until around 7 years, the child still may not be able to say some things that, are going on with the body. So you just gauge 8 is safe, 10 is safer, but 8 is safe. So we avoid cough syrups in children.
Okay. And then talk to us about asthma, because that's also another thing that, either as an allergic, it can be an allergic reaction, or a child can be born with the condition. How should a parent go about handling such?
Asthma is on the allergy spectrum, so it many times runs in families. I will say some adults develop asthma in life, adult onset asthma, so it may not have been something that was in the family, but most cases, I think I would say even 99%, even if you develop it in adulthood, if you look at your family line, you will see that somebody, close, first generation relatives, had some sort of allergy. It doesn't have to be asthma. So in children, yes, you will notice that we diagnose asthma after a year of life, because in the first year of life, a child may come into the emergency room with symptoms similar to an asthmatic attack, where the child is having difficulty breathing and wheezing, but they're happy. We call them happy wheezers, and this is something called bronchiolitis. An asthmatic will come in and they're not happy because they're in respiratory distress and it's really bad. But for bronchiolitis, then this child, it's a virus that has gotten into the small airways, they call the bronchioles, causing the inflammation and all that goes on, and then they start to wheeze. Now, that's why we will not make that diagnosis of asthma in that first year of life. It's after the first year of life, when we have less issues of bronchiolitis, is when we say, okay, putting everything together, family history, there's a family history of asthma or other allergies, and then the fact that when this child has been getting frequent asthmatic attacks, meaning there's coughing and wheezing, and when they have that, when we give the medication that takes care of that, which I know many people know Ventolin, that's one of the most common dawas that we give in asthma. So each time that they come in and we give that, there is relief. So putting all those things together in this child's history, then we say, okay, probable asthma, let's now do some tests. So it will either be done in the emergency room, or we send the child to either an allergy specialist or a chest specialist who will do some lung function tests to see how the lung is functioning. There are cutoffs that will tell us this is asthma. So then that is that. So children will come in, the most common presentation is that brings them into, especially an unknown asthmatic. You already know you're asthmatic, you have your inhalers, but you've used your inhalers, you've gotten an attack. Most common things that cause attacks, of course, is environmental, so dust, cold, infections as well. There are certain triggers that will cause you to get an attack. So you know what to do. You use your inhalers, but it's not getting better. There's a way in which we advise patients that have asthma that if you use your inhaler of an hour every 20 minutes, and you're not getting better, come into the hospital. So you come into the hospital and you're now breathing difficulties, you're really wheezing, because I don't know if you've seen someone who wheezes, it's really bad. You can see that they're really trying to breathe. They're using what we call accessory muscles of respiration, not your usual diaphragm only that's moving, but you see the nose is flaring, the chest is moving in an abnormal manner. So at that point, we have to intervene, because again, if you don't intervene, then it just gets worse.
Thank you, Dr. Lorraine. So now you know no use of cold water or unnecessarily giving medication to young children. And you can significantly reduce the risk of medical emergencies and help ensure your child stays safe at home. And these are some of the tips that you can, put in place or inculcate back at home in our good practice segment.
Prevent common illnesses by ensuring your child drinks plenty of water to avoid dehydration, especially in hot weather. That your child gets enough sleep to support their overall health. Keep an eye on your child's temperature. A fever alone might not be dangerous, but if it gets too high or lasts too long, seek medical attention. Prevent accidents by making sure sharp objects, hot items or chemicals are out of reach. And keep a close eye on young children, especially when they are playing or near water, roads or hot surfaces. Always use the appropriate car seat for your child's age and size. Ensure it's properly installed. To promote hygiene and healthy habits, teach your child to wash their hands regularly to reduce the spread of infections. And of course, keep up with all recommended vaccinations to prevent illnesses like measles, whooping cough, and influenza. Ensure your child eats a balanced diet to strengthen the immune system. Monitor allergies. Be aware of any food allergies your child may have and make sure to avoid those foods. And know what environmental allergens like pollen or dust affect your child and take steps to minimize exposure. Last but not least, be prepared for emergencies by knowing the emergency contact numbers in your area. And keep a well-stocked first aid kit at home with essentials like bandages, antiseptics, and medications for common ailments.
As we've seen, pediatric medical emergencies can be life-threatening and require prompt specialized care. Today, we've learned about the importance of acting quickly in these situations, whether it's dealing with a high fever or a traumatic injury. On that note, we've come to the end of the program. On behalf of everyone who made this program possible, the production team, and definitely Dr. Lorraine for sharing her insights on how to deal with pediatric medical emergencies. My name is Maria Ambon. In case you've missed any part of this program, remember you can always catch the whole program on our YouTube channel. Bye for now.